Hi, my name is Dr. Shaina, and today we're going to talk about posture and breathing. So I have many people who come in and say, oh, I know I have terrible posture, I really need to work on that. But there are many people also who say it's exhausting trying to hold good posture. What is posture to begin with? Posture purely is a position you move in and out of. There's no perfect posture at all. You should be able to be like this. This is not bad posture, it's just bad if we stay there too long. But then if you correct to this, you might get tired in a minute or so, and that feels really tiring. And it looks like I'm using a lot of effort to really sit tall, but this is just over-correcting. So you might feel tension here after a while, you might feel tension between your shoulders, you might feel like you can't breathe all the way because your ribs are flared out through here. And so finding that posture might really be talking about stacking. Let's talk about posture in sitting today, for example. There are many people who might be working on computers, or you sit at a desk, or you find yourself sitting on the couch or at your dining table, and you just can't seem to get out of this or get out of this, or just find a comfortable position where you don't have to keep shifting around. When people think of posture, sometimes they think of really holding themselves up. That's going to bring you towards overworking. You want to think of your posture as how you're positioning yourself over the ground or over what you're connected to. So in sitting, it would be a little on your feet, but mostly on your pelvis. So if I tilt my pelvis back, the rest of my body just kind of wants to follow back like so. We interact with the world in a horizontal way. So if I followed my pelvis and did this, then I would just do this. So in order to correct myself to interact with the world more horizontally and straight forward, then I end up slouching this way and jutting my head forward. That way I stay balanced. So in the opposite manner, if I tilt my pelvis and position myself this way, in order to not follow that and look down because I want to interact with the world out here, I would arch my back and kind of pull it back here. But that's too far as well. It doesn't really look comfortable or effortless. So what you might do is you might start by tilting your pelvis back and forth and finding, okay, where are my sits bones? I'm feeling those bones that are just kind of like a rocking horse at the bottom of my pelvis. And where does it feel like I'm not really using very much muscle? Feel really grounded into there. And so you can start all the way at one end, all the way at the other end, start to make it smaller and smaller and smaller until you're like, oh, there is a little bit less effort. From there, you can press down into those pelvic bones, and you can see how my body just kind of lengthens up out of that. So you're lengthening up by pushing down, not by holding yourself up this way, because this is just too much muscle effort. Use what you're connected to. This is actually a great tool for balance strategies as well. Anyway, we're talking about posture. So use what you're connected to here, and then you could just stack your body over that pelvis in a way that feels balanced, like you're building Jenga blocks or your kids are building magnet tiles, except we don't have magnets, it's a little harder that way. But you lift up this way. One of the reasons for being able to stack up this way is you want to be able to breathe well as well. We breathe at least 20,000 times a day, and it's unconscious a lot of the time. So you want to not be overextended, because here when you try to take a deep breath, you feel it all in the front of your ribs, and you don't feel like you can take a full breath in, or you can't exhale everything out. And you might feel increased tension in your back this way. Same manner, when you do this, it's really hard to take a full deep breath in and get that oxygen that your body needs. So when you're a little bit more stacked up, you can get that full 360-degree around the rib cage expansion like it's an umbrella. In order to get that diaphragm to contract well, it also affects the change up in the body as well. So the easy, relaxed breathing that gets that full rib expansion is going to help you, one, maybe channel into your parasympathetic a little bit more. If you're here, you're in the stress state, fight or flight state, sympathetic state. If you're here, maybe you get into that kind of tired, restful state, but you really can't breathe much because you're compressing the ribs in the front too much. This way, again, you can really get that full expansion. Breathing in and down, you feel your weight onto your pelvis, you don't feel like you're holding yourself up off the chair, and it's a bit more relaxed. Then you can move in and out of it. This is the most important part. The best posture is your next posture. You don't want to stay in any one position for too long, because that's what makes it a bad posture. Your body loves movement, your joints love movement, so the synovial fluid flows around. The muscles love movement because they love to contract and relax and stretch and shorten. So pretty much just don't stay in any one posture for too long, but make it effortless. Don't make it chin back, chest forward, shoulders back. That's old school and it's not necessarily correct. I hope you found this video helpful. If you have any questions, give us a call. You can come in for an assessment so we can see exactly what you and your body needs. And remember, there's no such thing as perfect posture. Just move, and of course, get yourself to breathe well. Breathing is super important, and it's the thing we do, one of the things we do most each day.